Anterior, superior, iliac spine.
Okay, so you got to find the iliac crest. You can go ahead and put your palms on the patient. Go ahead and find the crest, and on the anterior side, we are looking for the most prominent thing that we can find. And so that is right here and right here.
Anterior, inferior, iliac spine.
All right, from that landmark, so I'm there, I'm gonna go 2 fingers inferior. I'm gonna go 2 finger breadths medial. I won't know exactly when I'm on it, but I'm gonna feel a little bit of resistance, and that's your AIIS.
Iliac crest.
All right, iliac crest. I can come from the lateral side, and I'm just gonna push with my palms, and I can find the highest part, so it's located right there.
Iliac tubercle.
Again, from the lateral side, the crest goes all the way around, but the portion that is most lateral is going to be right there.
Greater trochanter.
All right, a couple different ways of finding this. I'm gonna first put your knees at 90-90. And we talk about this as clamming. So what the person is going to do is abduct and adduct several times while I have my hand on the lateral aspect of the hip, and I'm feeling where it's most prominent. Do it one more time. Yep, and it's located right there. So you're feeling what is jutting out most laterally. The other way that you can do it is if I bring her up here, I can do internal and external rotation of the hip, and it's also located right there. Pubic tubercle. So you're gonna start with the abdomen. For patient modesty, what I recommend is you take your 2 hands, overlap them one over the other, start at the umbilicus, and what you're gonna do is to press in approximately 1.5 inches. You're gonna come down until I hit bone that is right there. That represents the pubic tubercle.
You can feel the bone?
Feel the bone?
Yeah.
Yeah, it stops. Yeah. So when I'm coming, sorry to do this again. Push down. She can't laugh. Push, 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 push. I'm hitting bone right there.
All right. Posterior, superior, iliac spine.
On the posterior side, so if I find the iliac crest and I'm coming all the way around for the most prominent, all right, so crest is right there. Yeah, it's where the dimples are. You can do that if you want, but I'm finding what is most elevated on the posterior side. It'll be approximately 1.5 inches or so from the midline of the body, but our PSIS is located right there.
Ischial tuberosity.
Okay, she can be sideline facing this way. And your bottom knee here, why don't you flex that about 45 or 90 like that. We'll go ahead, actually we'll do this one 90 degrees, this hip 90 degrees. So just like that. And if I'm just pushing in here hard, I'm looking for the most bony prominence is your ischial tuberosity, what you're sitting on most of the time.
Sacroiliac joint.
All right, on your stomach, so you can just keep going there. We had previously found her PSIS. That's right there. Actually, where was it? I was a little too high before. I think here's more accurate. All right, so the PSI, did you say SI joint I'm looking for or what?
Yeah.
Okay, so if I draw the imaginary line that's going in between the 2 PSIS, that cuts across at S2, which is approximately the midpoint of your SI joint. So I don't want to be on the PSIS per se, I want to be just medial to it. And that is going to be the SI joint, the midpoint of the SI joint.
femoral triangle.
All right, lying supine. I think I'm gonna find a whole bunch of stuff with this simultaneously. So the femoral triangle, two of the corners of it I've already found. Here is the ASIS. The pubic tubercle was right there. So the superior border is the inguinal ligament that's connecting those two. The lateral border of the triangle is the sartorius, which comes off the ASIS, goes to pes anserine. And the medial border of it is your adductor longus. So that is the triangle. You can find it in any of those locations.
And then boop, right in the middle.
Well, if you were to point right here, that's not necessarily showing me you know where the triangle is.
So you want to spine all 3 points.
Well, I don't know if you're on the triangle here. I would know that you're on it when you're on the ASIS. I would know that you're on it when you are on the pubic tubercle. Does that make sense?
Mm-hmm.
That's like saying, I'm on the rectus femoris. How do I know you're on the rectus femoris? I would know you're on it if you're on the AIIS.
Inguinal ligament.
So that one I just did, pubic tubercle to ASIS.
Femoral artery.
All right, so if I've got those two landmarks, ASIS, pubic tubercle, and I bisect it, so it's right in the middle, then I can go just distal to it where I could find the femoral artery, femoral vein, and femoral nerve. The only one that you would know for sure that you're on is the femoral artery because you would feel the pulse. If you find it, you probably can't find it right on the inguinal ligament because that's the tenting or the roof that's protecting it underneath. You have to be a little bit more distal to actually get them.
Sartorius.
Off the ASIS.
Adductor longus.
Off the pubic tubercle. Oh, you could also, here's the other thing that I told you that you could do. So I'm gonna add abductor for a second. The pubic tubercle that is right here. So to preserve some modesty for the patient, I can start in more abduction. What I'm gonna ask her to do is try to adduct this leg back to the midline, and I'm gonna keep my hand where all these adductor muscles are, and I can probably feel the cord a little bit. So try to adduct, I'm gonna resist you. That cord right there, that's the adductor longus.
Trochanteric bursa.
So I think the easiest way, come around here, Miss Videographer. You can do the same thing. I'm gonna have you clamp. You can do it just on this side if you want, back and forth a few times. Here's your greater trochanter. So the bursa is just superficial to the greater trochanter.
Gluteus medius.
That inserts on the greater trochanter, so I'm fine with you doing that. But another way you could do it, why don't you side lie facing that way? And here is her greater trochanter. Here is her iliac crest. If I were just above it, so there's my greater trochanter. So I'm going just above it. Now abduct this leg. That I'm feeling her gluteus medius right there activating. But I'm fine with you palpating it just on the greater trochanter.
Sciatic nerve.
All right, this is a good position to be in, so you can keep that leg where it is. Bring this hip to 90 degrees, that knee to 90 degrees. What you're gonna do, right here, that's her greater trochanter. Right here is her ischial tuberosity. I'm going to bisect that imaginary line right in there, and that's the approximation of where your sciatic nerve is, but only when the hip and knee is at 90 degrees.
Cluneal nerves.
Cluneal nerves, you won't know, you can lie supine. You won't know exactly when you're on it, but they're the thin pieces of spaghetti that you feel that are covering right over your iliac crest. So obviously she has some clothing on here, which is making it more of a challenge for me to feel what I'm rolling over. Is that the fabric or is that the actual cluneal nerves? But they will wrap right over the rim on the iliac crest. Yeah, you don't want clinical sig, so.
Iliopsoas.
Okay. A couple different ways. Let's do it this way. We're gonna find your ASIS. We're gonna find the approximation of your umbilicus, and we're gonna draw an imaginary line between the two. So it's gonna bring me right about here. So I'm going to be pressing down right there when I'm asking her to activate the muscle by flexing her hip. So with your knee extended, I want you to lift your heels up off the table. Go ahead, done, just this one. So when she does that, I'm feeling, I was too far over, do it one more time. I'm feeling the contraction right under here because it's coming off the lumbar vertebrae and all the way down. Do it one more time, right there. So that's the location. Umbilicus, ASI is about halfway through. She develops tension within the muscle when lifting up, and then you'll feel it. The other way you could look at it, you have your inguinal crease that's right here. It's gonna be just superior to the inguinal crease.
Quadriceps.
As a group, they are all in the front. Do I just ask them for in a group? I don't have to do them individually.
No, it just
Yeah,
says quadriceps.
yeah. Just point to the anterior part of the thigh because they're all there.
Gluteus maximus.
All right, you are lying prone. It's your butt muscle that's right here, but to confirm I'm on that versus the hamstring, what I'm going to ask her to do, flex your knee to 90 for a second. Now what I want you to do is extend your hip by lifting your thigh off the table. Right there, I feel the muscle contraction of the gluteus maximus.
Tensor fascia latae.
Okay, why don't you side lie facing AJ. And so I've got my iliac crest, that's right here. Here's my ASIS. So it's the anterior 1/3 of it that's coming all the way through. So I can go anywhere on the iliac crest, right in there.
Hamstrings.
You can lie prone for me. And I'm not asking them individually, right?
Oh.
Boop. There you go. Anywhere on the posterior thigh.
Ilium.
How do I have it? Ilium, ischium, pubis, or what's on the list?
Ilium, ischium.
Okay. So for ilium, pubis. Let's have you sideline so you're facing AJ. So the iliac crest, that's right here, is part of the ilium. Ischium was next. So 90-90, if I were to go ahead and find the ischial tuberosity, that's my ischium. Now I'm gonna have you lie supine. And we did it before where I found her pubic tubercles, which are right there. So the pubic tubercles are on the pubis bone.
Sacrum. Coccyx.
Flip over for me. So I'm going to find her PSIS right there, right here. Yeah, it was too high. This is definitely it, here and here. The sacrum is in the middle of it, which is going to be right here. So here's my sacrum because that imaginary line is S2. Now, if I were to keep following it all the way down, it's sacrum and then coccyx. You don't know when it transitions over from sacrum to coccyx, but as long as you found S2 and said sacrum and said, again, patient modesty, I don't have to get all the way down, but coccyx would be the end of your tailbone.
Superior gluteal line.
I'll be right back. Superior, middle, inferior. However, you probably won't have this on Thursday. So using that as your guide, you should know superior, middle is going to be right in the middle, inferior is going to be right there, which is going to match up exactly with what we just had there.
So like you can't find the crest on her and then imaginary line it? Alright.
Too much soft tissue.
Femoral head.
I'm going to borrow that a second.
Femoral neck. Greater trochanter. But you could do it.
Oh yeah, you're right. Yeah, thank you for that. Greater trochanter. Excellent. Sideline facing her. I'm just doing it the other way right now just because I know it's right there. But you could have her supine and clam. This is some of that internal and external that I was doing before, so I can feel it right there as well.
Lesser trochanter.
That one you can't find on your patient. So opposite side of greater, that's your lesser right there.
Next page. Intertrochanteric line.
It's not a good one. Do you have another one? Ooh, much better. The intertrochanteric line is on the anterior side, so that's the elevation change between the shaft and the neck, so that's right there.
Intertrochanteric crest.
Crest, that's the larger elevation change right there between the shaft and the neck.
Steroidal tuberosity.
Right there, that bump.
Linea aspera.
Right there on the posterior femur, that's the elevation change.
Gluteus medius.
I think we already did that one. I think it might be on there twice.
Gluteus minimus.
I think I did that one too. It's on there twice.
6 deep lateral rotators of the hip.
It inserts on the greater trochanter, so that would be fine. We've done that several times.
Pectineus.
All right, so getting into, you can be supine. All of your adductors come off your pubic bone, in addition to some other things. So I think you will be fine with coming down and establishing, here's my pubic tubercle. The pectineus is a little bit more lateral, but it's coming off the pubic bone, just lateral to the pubic tubercle.
Adductor brevis.
The brevis by itself is going to be difficult to know when you're on it, but if I were to find the brevis and longus as a unit, I would have her abduct. I'm going to be over her adductor group on the medial aspect of her thigh. On the proximal end of it, I'm going to ask her to adduct her leg, go ahead and do it. All right, so right there, the cord, that is my adductor longus. The musculature right next to it is the adductor brevis. So it's right next to the longus, but not the cord-like structure.
Adductor magnus.
You can find it in one of two locations. One was ischial tuberosity, which is its origin, or you can find it in its distal insertion, which is your adductor tubercle. So here is her epicondyle. I have to go along the long axis of the femur, And right there is her adductor tubercle.
Gracilis.
I suppose I could find it up on the pubis if I wanted to, but I'll find it. Can we pull this up or not? Don't worry about it. Pezanserine. We've already found pezanserine. So if I have, here's her patella tendon, here is her tibial tubercle. If I go 1 finger breadth medial to that, that's my pezanserine.
And it's like all the nerves, but you say we're not palpating.
Yeah, the nerves you're not palpating for Thursday.
Acetabulum.
You're fine. Where is it? Right here.
Ligamentum teres.
So it is the ligament that goes from the head of the femur into the acetabulum.
Iliofemoral ligament. Y ligament of Bigelow.
That we can find on here. One of its 2 attachments is coming off the AIIS. So here's my anterior. See this? I don't know if you guys are going to see this. Like, I'm just doing this and I'm finding it. I don't know if it's coming through on the video, but the ASIS is the most prominent thing that you find in the front. So here's ASIS. 2 fingers below, 2 fingers medial. So that, where I'm pressing, I can feel it a little bit, is one of the 2 attachments for... No, that's the only proximal attachment for the Y ligament of Bigelow.
Pubofemoral ligament.
So what I'm gonna do, I'm gonna go back and find my AIIS, and I'm just gonna move towards the direction of the pubic tubercle. And so I don't have to go far. I can probably just go about 2 finger breadths. I gotta push pretty hard, but that's gonna be my pubofemoral ligament. The Y ligament is more diagonal between the longitudinal and lateral direction, I should say transverse, whereas pubofemoral is a little bit more of a transverse orientation.
Ischiofemoral ligament.
I could find it on the acetabular rim, or I can find it on her greater trochanter where it inserts. So I'm doing some clamming. I don't really like that. So if I go back and forth, I can feel it right there. So internal and external rotation.
Labrum.
So it lines the rim of the acetabulum.